Some of it might be squeamish, some of it might not be, so prepare yourself effectively. So obviously I'm an audiologist and got umpty years of experience dealing with ears, ear canals, wax removal, hearing aids, and so on and so forth. I was trained in the Blackburn down south to do the microsuction on real patients, now on dummies and microsuction in blue tack on some very cheap course that some audiologists around here maybe have attended and things like that. I was looked after by a proper ENT person. I had to microsuction X number of real patients whilst he's looking directly what I was doing as well. So much so that I had that microsuction even beyond the eardrum, which is in the middle ear, effectively, at some point. So first of all, I really kind of wanted to talk to you a wee bit about the hearing organ, just to kind of give you a bit of a general kind of idea of it. Ear is effectively has three parts. Outer, which is that part there from outside, from the outer part to the eardrum, that's the outer ear. Then we have the middle ear, which is that kind of blue area where we have the three smallest bones in our body. And then we have the inner ear, which is this looking thing. It's called cochlea. That looks like a snail a wee bit. We have the semicircular canals just right connected there, and they're responsible for the balance issues, effectively, that's happening in our body. So I was going to talk to you a wee bit about wax. Wax officially is called cerumen. It's there to protect the ear. It has a different consistency. You know, when it's fresh, when it's new, it's slightly yellowish carrot color. When it's been there for a wee bit, it's slightly darker. It can vary consistency as such. They can be pliable, it can be flaky, it can be different. It'll be different from a person to person in many ways. However, the most important bit about the wax is there to lubricate, protect, but also is there to kind of protect the kind of the lining of the ear canal, or so no bugs go inside it. It has a slight antibacterial kind of property to it. So it's there. We see it as a nuisance at times, but actually it's there to protect the ear canal itself and the eardrum as well. Obviously, as you know, excessive kind of amount of wax is impacted debris effectively, because wax is a debris, and that's predominantly dead skin cells, sweat, and whatever it's in the air, whatever dust and things like that. And that's actually equals wax in many ways. So I've kind of listed little things just there regarding blockage, what kind of wax can contribute. So we have an earache, you know, a slight discomfort effectively, and we're not talking about something sore like a toothache. Yes, it can contribute towards ear infection because at the end of the day, bacteria can trap behind it, and it's just a platform for growth of bacteria. Yes, you can have the occasional shivers, i.e. itchiness, and that's probably the wax starting to kind of build up, or is just moving about effectively. You may kind of have the sensation of you have your finger stuck in your ear because the ear canal is fully blocked with wax. But as soon as the wax is taken out, everything kind of goes back to normal. Taking into consideration that obviously if you have normal hearing, you will kind of experience the night and day effect as soon as the wax is kind of taken out. But obviously if there is a hearing impairment there, the wax will not make your hearing, by taking it out, will not make your hearing better anyway, because you have a permanent hearing impairment. What else? Yes, it can contribute towards vertigo or dizziness, because at the end of the day, if debris is pushing against the eardrum, it's pushing physically along the three bones, and the eye is ever so slightly pushing towards the inner ear, and that's causing a slight imbalance of the chemical reaction that's happening in the semicircular canals, which are the three little kind of semicircular canals over there, the weird looking things. And yes, it can cause coughness, because at the end of the day, ear canal in adults is about 2.5 centimeters in length. The first 3/4 is cartilage, the ear canal. The rest of it nearby the eardrum is bone. By the cartilage side of the ear canal, we have tiny little nerve endings that are responsible for pushing the wax out. However, you know, ear canal does move, goes up and down as you speak or as you chew. But if you have a wax inside the ear canal, as in that part of the ear canal itself, When the ear canal is when the wax is moving, it kind of gives you that tickly effect, as in kind of tickle the back of your throat, or even sometimes make you sneeze. You might be watching television, reading a book, you touch your ear, you go, oh, what is that? Oh, it's time to come out. Wax has its own mind in many ways. I have put that bit there at the bottom, and I really want to point that out bit there, cotton buds. Please do not use them. They're not there for your ears, they're there for ladies' makeup and babies' belly buttons. Hence why you can't get them, you can only just get them in a particular section in the supermarket. You can't get them anywhere else apart from, belly buttons and makeup kind of thing. Because at the end of the day, the more you kind of use a cotton bud, you think you're taking stuff out, but really with the tip of the cotton bud, you're just pushing the wax deeper and deeper and deeper, and it's just building up. And if it's touching the eardrum, well, that might be uncomfortable to some patients, so don't ever use them. The best thing, and I don't have a tissue here, but if you could imagine, maybe this is a piece of tissue, not toilet paper for obvious reason because of bacteria. If you have a disposable tissue right in the middle, scrunch it up ever so slightly and just dry your ears that way. Do not try and form a cotton bud kind of thing. You're not trying to twist it so much that you're mimicking a cotton bud, ever so slightly. I don't know. Microsuction, I don't know what to tell you about this. To me, they're very self-explanatory, apart from that's microsuction. We use a microscope to look directly inside the ear canal wall, and then we use tools and a proper suction machine to, inverted commas, hoover the wax out. Now, of course, we're not using a Dyson or a hoover to take that wax out. We're using a controlled machine that suctions that wax out. Now, sometimes we would use tools that are not connected to the machine to scoop some of the wax out as well, but most of the time we will be using the microsuction tools. And in many ways that's kind of, it looks like, I will be looking into someone's ear and then microsuctioning directly. It's direct vision, it's not blind like syringing kind of idea. You have a guess that you flush some stuff out, jet washed and things like that with syringing. Whereas with microsuction, most definitely, you just see it and you do what you need to do. Actually, that's what I was just telling you. All of that is microsuction is earwax technique. We use the microscope effectively, sterile equipment at low pressure, and of course we need to use different tools. There is a different way as well now that we have been trained on, and it's called endoscopic wax removal. This one is ever so slightly different. It's very similar to the microsuction. However, we have this little camera now that goes inside the ear canal itself, rather than looking through the binoculars effectively. We're looking with a camera and then microsuction. It's more internal effectively rather than external. Now the next thing I'm going to show you, and I apologize in advance if some of you may not like it, this is me taking wax out of a ear canal. It's very short, I can see your face. It's very short, it's not yucky. Cover your eyes if you want to. It's 10 seconds, thereabout. And should start any minute now. So this is a patient that I have recently seen, probably in the last week or so, 10 days max. So this is the endoscopic. So I have this camera, tiny tube, goes inside the ear canal, and I can see directly with the camera on the screen what I'm doing rather than looking through the microscope. And that's me just pulling the wax out with the microsuction. The microsuction is holding on to that piece of wax, and that's his ear canal at the end. I will do my best to kind of stop it effectively at the point that I want you to see. So again, sorry in advance. So that's a debris that was there for a week, that's been there for a wee bit. I've obviously done otoscopy, which is the visual inspection, and then the wax is kind of stopped. May not be able to, but there's the eardrum. The eardrum looks lovely and healthy. We have the cone of light, which is that bit there between 4 o'clock, 5 o'clock. It literally looks like 3 pieces of cling film put to the light. Lovely, nice, non-damaged eardrum. And the last thing I wanted to say is, yeah, microsuction is effective, comfortable, safe. It's one session. We don't ask you to put any oils or anything like that in your ears. We would rather have your wax hard as this rather than be mushy, because I can't put Mr. Muscle in it and clean all the ear canal. But if it's hard, I'll be able to take all of it out, most definitely. It's not messy. I don't have to use water. Safe for perforations. I do have to use sometimes wax softening oil, but that's purely for my benefit because it gives me a better traction between the wax and the microsuction, so I can take it out. It's not there for me to soften the wax. Yes, it's quick, pain-free, uncomfortable. I may make you sneeze, but do you know what? I'll give you a glass of water, you'll be fine. And a tissue if you need to. Any questions? It just depends. No two ear canals are exactly the same in the same person even. My ear canal, this one kind of goes that way, this one kind of goes that way. This one definitely it has its own mind and makes wax so I can make tatties, or God knows what, grow tatties. This one does nothing. Nothing happens in this one. It just really depends. Wax sometimes can be contributed by medication, lifestyle, environments that you are in, and things like that. You know, sometimes it forms faster and more during the summer rather than during the winter. It depends from person to person. It has its own mind. Simple as that. I tend to recommend to patients not to be using anything inside their ear in order to listen to music or plugs and such, mainly because I always, as I explained, wax does have a tendency to be shifting out. So every single time you put something back into it, you just push the wax back in, and then it's kind of collecting effectively. If it's for listening music, I would prefer you to wear something like headphones rather than inserts. If it's for a hearing protection, we could custom make them as to a point that they're not contribute towards the kind of build-up of the wax, or you could wear this box standard earmuffs kind of idea effectively, which can come in various different colors, by the way. I do prefer almond oil, I have to admit, rather than olive oil when patients using their ear canals, because I do feel that almond oil has more of a kind of an antibacterial property to it as well, rather than just olive oil, which is basically oil. So, and of course, if you do put oil inside the ear canal and the ear canal has wax, some of the oil will be absorbed by the body, but most of it will be absorbed by the wax as well itself, which means expansion, which means really cutting off whatever you can hear in that side. You buy a little bottle at the pharmacy shop. It costs a couple of pounds. It doesn't have an expiry date. You don't have to keep it in the fridge. That's all it is, less than a fiver, kind of idea. The only thing that I would say is that if by any chance you may feel you are having an ear infection, get a second bottle and never use the same bottle for both ears, because otherwise you have a chance of cross-contamination. Just with a marker, put R and L kind of left and right.